Topic is facial implants, and what I wanted to show is my favorite cheek implant. It's porous polyethylene, so it's not silicone. What's nice about it is it behaves the way bone does, in that when we place it against the bone, because it has a rough surface, that sticks really nicely to the soft tissues on top of it and helps hold it up. Look how nice the implant sits on top of the bone, and it gets anchored there with two little tiny screws so it doesn't rotate, and that's put in through an incision inside the mouth and then again positioned appropriately on the orbital rim and on the cheek to give a nice, subtle, natural boost to the cheek tissues. Here's an important thing about cheek implants. When we're placing a cheek implant, we're going through the mouth almost always. There's a nerve here that gives sensation to the cheeks. When we're dissecting out that tissue, we want to make sure that we don't injure that nerve. And what's really cool about the design of this implant is it has a little notch to go around that nerve so that there's not pressure on the nerve. Okay, so chin implant. When I do a chin implant, I don't use a silicone implant. I use a porous polyethylene implant. That has a structure that's kind of rough, like the outer surface of the bone, and helps support the soft tissues. This one is placed actually through a small incision underneath the chin, and sticking it through that incision, it's really cool. Look at this. It comes in two pieces. You stick one side in, the other side in, and then you can assemble it inside, and then it gets screwed onto the bone with two little screws to prevent motion and rotation. It's different from the way most silicone implants are placed, and that's what I prefer about it. Okay, so an important thing with chin implants, when we're placing a chin implant, we have to be mindful of the mental nerve. That's the nerve that gives sensation to the lips. Now, whenever you do any procedure on the jaw, you're gonna have some temporary sensation change. But when we place a chin implant, we wanna make sure we do it in a way where we don't have compression of the implant on the nerve. Some of the implants that we have are a little bit bigger and they can get close to the nerve. If it looks like it's too close, we carve a little bit of that implant away so there's a nice notch, no pressure on the nerve, because we want to not have long-term decreased sensation.